Have you ever had that feeling, that nagging, persistent fatigue, and you just can't shake it, and you start to wonder, is this something more? Well, today, we're going to go on a little medical detective journey. We're going to see exactly how doctors take that one common complaint and start unraveling the clues hidden inside your blood.
You know, it almost always starts with this one question. A question I'm sure many of us have asked ourselves at some point. Why am I so tired all the time? It's that persistent, just dragging feeling. And yeah, it's super common, but what if it's your body trying to tell you something more than just, hey, you need more sleep? And really, that's the key right there. Let's try to reframe this whole thing. That feeling of being tired, it might not just be a problem to push through. It might actually be the very first clue your body is sending out, the start of a little medical mystery that we're about to dive into. So, let's set the scene. Imagine your doctor's office is the headquarters for an investigation. Your doctor, they're the detective, and their first job is to gather all the initial clues. And you, well, you're the most important person in the room. You're the primary witness. Okay, so the detective work kicks off with some pretty broad questions. They're looking for patterns. It's not just, are you tired? It's, does that fatigue come with anything else? Maybe you're feeling short of breath just from climbing the stairs. Or you get a bit dizzy sometimes. What about your heart racing for no apparent reason? See, every single answer you give helps build the case.
All right, from there, the investigation starts to zoom in on more specific visual clues, things you can actually see. The detective might ask, hey, have you noticed your skin looking a little paler than usual? Or, are you finding these weird bruises and you have no idea how you got them? Even something that seems small, like sores on your tongue, that can be a super important piece of evidence.
And then, of course, they have to look at your life outside the clinic walls. Your lifestyle is a huge part of the puzzle. What's on your plate, for example? A vegan diet could be a big clue when it comes to B12 levels. And get this, even your daily coffee habit matters, because caffeine can actually mess with how your body absorbs iron. They're also going to ask about medications, things like anti-inflammatories or pills for acid reflux. All of it plays a role.
So after gathering all these clues from your symptoms, your body, and your lifestyle, a few, let's call them usual suspects, usually start to emerge. These are the main conditions that this whole trail of evidence often points to.
Okay, suspect number 1, iron deficiency anemia. This is a big one. It's pretty simple, really. It happens when your body just doesn't have enough iron. And why does that matter? Well, without iron, you can't make enough healthy red blood cells. I love this analogy. Think of your red blood cells as a fleet of tiny delivery trucks, carrying oxygen all over your body. If you don't have enough trucks on the road, everything starts to slow down. And that's where that deep fatigue comes from.
All right, next up, we've got B12 and folate deficiency. Now, these vitamins are also super important for building those red blood cell trucks, but they have another really critical job, keeping your nervous system healthy. And that's a huge deal because it means a lack of B12 can cause totally different clues, things like that weird tingling feeling in your hands and feet.
And our third usual suspect is something called thrombocytopenia. This one is all about your platelets. So let's stick with our analogies here. If red blood cells are the delivery trucks, think of platelets as your body's own emergency paramedics, right? They're the first responders. They rush to the scene of any cut or injury to plug the leak and stop the bleeding. So you can imagine, if your platelet count is low, that whole emergency system is in trouble. That's why the big clues here are things like that weird bruising or bleeding that just doesn't seem to stop.
Okay, so now things get really interesting. This is where the detective has to start telling the suspects apart, right? Because they each have their own unique calling card. Sure, fatigue can be a common thread, but the other clues are really distinct. For iron deficiency, a doctor's going to be looking for things like pale skin or maybe headaches. But for a B12 or folate issue, the clues are totally different. They're listening for you to mention things like tongue sores or those very specific nerve symptoms, that tingling in your hands and feet, or even problems with your balance.
So the detective has the clues, and they've lined up the main suspects. But to actually crack the case for good, they need hard evidence. And you know what that means. It's time to go to the lab.
And this is the investigator's toolkit. It all comes down to a simple blood drop that can give a ton of answers. They'll run a whole panel of tests, a complete blood count, of course, your B12 and folate levels, and this really important one called ferritin. Now think of ferritin like your body's iron savings account. It doesn't just show the iron you're using today, it shows how much you have stored up for a rainy day. It's a much better picture of your true iron status.
All right, so once the case is cracked and there's a confirmed diagnosis, the whole focus shifts. It's not about the mystery anymore.
Now, it's all about having a clear, structured plan to get you back on track and feeling better.
For iron deficiency, the plan is usually pretty straightforward. It starts with iron tablets. But, and this is super important, the follow-up is absolutely critical. Your doctor will want to recheck your levels in a few weeks just to make sure the treatment is actually working. And here's the thing that surprises people. Even after your levels get back to normal, you'll probably keep taking the iron for about 3 months. And why is that? Well, you're not just topping up your daily spending cash, you're trying to fully restock that iron savings account we talked about.
Now, for B12 and folate, the plan is really tailored to the why and the how bad is it. A simple folate issue because of your diet, that can often be fixed with daily folic acid tablets. Easy enough. But if a B12 deficiency is causing those nerve symptoms we mentioned earlier, the approach gets way more intensive. We're talking about a course of injections, because you need to get those levels up fast to protect your nerve function. It's a whole different level of urgency.
When it comes to thrombocytopenia, it is all about the numbers. It's a pure numbers game, because your platelet count directly relates to your risk of bleeding. Just take a look at this. It shows exactly how the count dictates what needs to happen and how fast. If your count is just a little low, say between 150, it might just be a watch and wait situation. But you can see, as that number drops, the urgency for a specialist gets higher and higher.
And this number right here? Anything below 20? That is a major red flag. We're talking a high risk of spontaneous bleeding. This requires an immediate, same-day referral to a hematology specialist. This is absolutely not something you wait on.
And you know what? That brings us to probably the single most important takeaway from all of this. It doesn't matter what the diagnosis is, this right here is the critical safety advice. If you have symptoms like dizziness, shortness of breath, chest pain, or a really severe headache, those are your body's alarm bells going off. Don't ignore them. It's time to seek urgent medical help.
So here we are, right back where we started, but hopefully with a totally new perspective. That fatigue, that bruising, that dizziness, they're not just annoyances to be pushed aside. They're data, they're clues. And look, obviously this isn't medical advice, but hopefully it's a prompt for you to become a better detective when it comes to your own health. Which leaves us with one final question to think about. What clues is your body sending you?